Welcome back to the Deep Dive. If you're tuning in, you're probably looking for that deeper understanding, the actionable intelligence on, well, some pretty complex global issues. And today we're taking a hard look at the World Health Organization, the WHO. Our goal here is to really zoom in on what the WHO is actually prioritizing right now in 2025. What are the big battles they're fighting? And at the same time, we have to look at the, let's say, messy reality of their funding, the financial side, and these intense political pressures that are really shaking up global health. We've dug into a lot of recent reports, news analyses to kind of map this out.
Absolutely. And the big picture, the WHO's stated objective, it hasn't changed. It's huge, getting all people to the highest possible level of health. And they've had some massive wins historically. I mean, smallpox eradication, that's a classic example. A singular triumph. But the real tension today is that contrast, isn't it? Between those clear-cut historical victories against a specific disease and the sprawling, chronic, really complex crises we face now.
Yeah, we need to remember those successes. Smallpox in '79, that saved millions of lives every year. And the fight against polio, a 99% reduction in global infections thanks to sustained effort. It shows the framework can work incredibly well when the target is, a defined pathogen.
Okay, but let's unpack this shift.
Yeah.
Because, like you said, the battlefield looks totally different now. The data we're seeing shows the WHO isn't just fighting germs anymore. It's fighting lifestyle, environment, even the economy, right? These non-communicable diseases, NCDs, they are now the main cause of premature death globally.
That's right.
Think about this. In 2021, NCDs killed 43 million people. 43 million. That's 3/4, 75% of all deaths worldwide if you exclude the pandemic figures.
Huge numbers. And here's the part that really hits hard, the equity gap. 82% of those premature deaths, people dying before 70 from NCDs, they happen in low and middle income countries, LMICs. So the burden is everywhere. But the early tragic deaths concentrated among the world's poor.
And when we talk NCDs, it's mainly four big groups we're looking at. You've got cardiovascular diseases, heart attacks, strokes, they cause about 19 million deaths. Then cancers, nearly 10 million.
Wow.
Chronic respiratory diseases like COPD, that's around 4 million. And diabetes, over 2 million deaths directly attributed.
So these aren't just random biological events.
Not at all. That's the crucial point. They are driven by things we can change, modifiable factors in the environment around us. The usual suspects, right? Tobacco, not enough physical activity, drinking too much alcohol, unhealthy diets often pushed by easily available ultra-processed foods. But we absolutely cannot ignore the environment now. Air pollution is officially a leading risk factor. It's linked to 6.7 million deaths globally each year, mostly through NCDs like lung disease or heart failure.
Okay, so with that backdrop, 43 million deaths, these huge drivers, are the policy responses actually matching the scale of this crisis? I mean, we saw some announcements from the World Health Assembly back in May 2025, didn't we? Focused on NCDs.
We did, yeah. There was some definite forward movement. They passed the first ever resolution specifically on kidney health, recognizing it's a growing global problem.
Okay.
They also set up World Cervical Cancer Elimination Day, November 17th each year, a good awareness move. But maybe the biggest policy lever they pulled was updating the essential medicines list, the EML.
The EML, that's always significant.
Exactly. This update added some really critical new cancer treatments, things like immune checkpoint inhibitors. And crucially, it added the GLP-1 agonists.
You mean drugs like semaglutide, tirzepatide for diabetes and obesity?
Those are the ones. Getting them on the EML is huge, symbolically and clinically. It says these drugs are essential.
But
okay,
here's a question, isn't it? The WHO committee itself flagged the cost. If these are essential game-changing drugs, but they cost a fortune, especially in those LMICs where people are dying prematurely from these conditions, how much real impact does putting them on a list have? Is it just symbolic, or is there a plan for affordability?
That's precisely the hurdle. It's the multi-billion-dollar question, really. The WHO listing gives a sort of moral mandate, maybe helps countries negotiate prices, or even push for generic versions down the line. But right now,
it's the price.
The price is the wall. We have the medical solution, but the economic system to get it to everyone fairly, it's just not there yet. And that tension, that gap between the list and the access, really defines the WHO's struggle with NCDs today.
All right, so moving beyond the physical NCDs, the definition of health is clearly broadening. We need to talk about two crises that often fly under the radar, but are having devastating impacts: mental health and social isolation or loneliness. The statistics are just mind-boggling. Based on 2025 WHO data, over 1 billion people, are living with a mental health condition. Anxiety and depression are the most common.
1 in 8 people globally.
Yeah. And the human cost is obviously immense, but the economic cost, that should make everyone sit up. Depression and anxiety alone are estimated to cost the global economy about $1 trillion every single year, mostly in lost productivity.
And that $1 trillion, it's not just an abstract figure, is it? It's millions of people unable to work, struggling families, lost potential, and the worst outcome, suicide. 727,000 lives lost in 2021. We're supposed to be reducing that rate by a third by 2030 under the SDGs.
How are we doing on that?
Badly. We're way off track. The projection is only maybe a 12% reduction by 2030, nowhere near the target.
And the funding for this massive crisis affecting 1 billion people. Tiny, right? I saw the reports mention median government spending on mental health is stuck.
Stuck at just 2% of total health budgets, and that figure hasn't really budged since 2017.
2%, that's it.
That's the median. And the disparity is huge. High-income countries might spend, say, up to $65 per person per year. Low-income countries, sometimes as little as 4 cents per person.
4 cents.
The investment level is completely disconnected from the scale of the problem. The WHO can highlight the crisis, sure, but without real financial commitment from member states.
Well, they remain just horrifying statistics, don't they?
And as if that wasn't enough burden, now we have this focus on the loneliness epidemic. There was a big WHO Commission report on social connection in June 2025.
Yes, a really important piece of work.
It found that 1 in 6 people globally are affected by loneliness. 1 in 6. And get this, it's linked to an estimated 871,000 deaths every year.
That works out to, what, about 100 deaths every hour, linked to being socially isolated every hour.
Yeah.
And it's not who you might think.
Exactly. We tend to picture loneliness affecting older people, right? But the data actually shows it hits young people hard. Somewhere between 17% and 21% of teenagers and young adults, like 13 to 29 years old, report feeling lonely.
That's surprising.
And perhaps even more surprising, it's reported more in low and middle income countries. 24% of people there say they're lonely. That's double the rate in high income countries. So it's truly global.
And the key here, why the WHO is treating it as a public health emergency almost, is the physical impact, isn't it? This isn't just about feeling sad.
Precisely. Loneliness significantly increases your risk of having a stroke, developing heart disease, diabetes. It even doubles the chances of developing depression. It's a real physical health threat.
But tackling these things, NCDs, mental health, loneliness, and it requires real policy muscle, doesn't it? Regulating tobacco, food industries, maybe social media. And that's exactly where the WHO seems to hit a wall, a political wall.
That leads us perfectly into the next area. We've talked about what the WHO is trying to fix. Now let's talk about the forces that might actually be working against those solutions. The WHO is facing these twin pressures that really challenge its integrity, its credibility. One is interference from major industries, and the other is, frankly, a lack of transparency around some of its funding.
Right.
There was a stark WHO report recently on what they call the commercial determinants of health, specifically in Europe. The findings were, well, pretty damning.
What did it say?
It found that just 4 industries, tobacco, alcohol, ultra-processed foods or UPFs, and fossil fuels, are collectively responsible for 2.7 million deaths every year in the WHO European region.
2.7 million.
Yeah, that's nearly a quarter, 24.5% of all deaths in Europe. And the report detailed how these industries use tactics, both obvious and hidden, to basically interfere with public health policies. Things like lobbying against smoking bans, fighting restrictions on food advertising, you know the drill.
Okay, so industry interference is one thing. But then there's the money itself, isn't there? Particularly around the WHO Foundation. That's the independent body set up to bring in private money.
Exactly. And this is where it gets murky, where this idea of dark money comes in and starts to potentially erode the WHO's credibility.
So what are the numbers?
Well, through the end of 2023, the foundation had brought in about $83 million. But here's the catch. For roughly 60% of that money, the donors' identities were kept secret.
60% anonymous.
And it's getting worse, apparently. In 2023 alone, 80% of the foundation's funding came from anonymous sources giving over $100,000 each. That's way up from about 15% in its first year.
Wow. Okay. So the reliance on large anonymous donations is increasing dramatically.
It is. And critics are, quite rightly, I think, raising red flags, serious conflict of interest concerns. The WHO's credibility, its reputation for impartiality, that's arguably its single biggest asset, right?
Yeah.
If you don't know who's giving the big checks, how can you be sure they aren't influencing the agenda, pushing certain policies or maybe discouraging others.
And we even see potential conflicts with the donors we do know about. I saw Meta, Facebook's parent company, listed as a donor, funding communications departments at the WHO.
Right.
Yet, at the same time, the WHO is raising alarms about social media's impact on children's mental health. How does that work? Can you effectively call out harms caused by the very companies funding parts of your operation?
It creates, at the very least, a massive perception problem. And perception is everything in global governance. The WHO needs to be seen as impartial. When huge private interests, especially ones that profit from the very NCDs or issues the WHO is meant to be fighting, become major untraceable funders, well, it risks making health policy look like it's driven by private agendas, not public need.
Okay, so amidst all these chronic health problems, these funding questions, the WHO still have to deal with sudden, acute crises, like the Mpox outbreak in Africa right now.
Yes, that's a major focus.
In August 2024, it got serious enough for the WHO to declare it a public health emergency of international concern, a PAEIC. The Director General, Dr. Tedros, called the situation very worrying. He pointed specifically to a new strain, clade IB, and also drew parallels to the early days of the HIV epidemic because of how it's spreading, particularly through sexual networks, and the intense social stigma involved, which makes it harder to control.
And the response immediately throws that equity issue into sharp relief, doesn't it? The WHO released $1.5 million from its emergency fund.
Which sounds like a lot, but...
But the estimated need for the immediate response is $15 million. So a tenth of what's needed. And experts are saying, look, if this dangerous new Mpox variant showed up in Europe or North America...
it would likely be contained quickly.
Almost certainly. With fast testing, readily available vaccines. But getting those same vaccines and tests to the remote, poorer areas in Africa where this is hitting hardest, that remains a huge challenge. The global health divide is right there if a vaccine exists, but it can't easily get to where it's most desperately needed.
And speaking of global divides and political earthquakes, January 20th, 2025. That date marks a huge shift in global health, doesn't it? The day the United States formally pulled out of the WHO.
A seismic moment. Yes. Triggered by a presidential executive order. Remember, there was a previous withdrawal notice under the Trump administration that was reversed, but this time it went through.
And the reason cited?
Officially, the U.S. pointed to criticisms of the WHO's handling of the early COVID-19 pandemic, saying the emergency declaration was too slow, that they relied too much on incomplete information, allegedly from China. And there were broader accusations of undue political influence by certain member states, particularly China.
The impact on the WHO's budget must be enormous. The U.S. was the biggest donor by far historically.
Absolutely. They typically provided around 20%, maybe more some years, of the entire WHO budget. Losing a fifth of your funding overnight, that's a massive blow. You can't just absorb that easily.
But what happens now?
Well, WHO leadership immediately called on other countries to try and persuade Washington to change course. But fundamentally, it changes the landscape. It probably accelerates this trend towards a more fragmented, decentralized global health system. Meaning regional bodies, like the Africa CDC, for example, likely become stronger, more influential in their own right. But it also leaves a power vacuum at the global level. And nations like China might well step further into that space, increasing their influence on global standards and priorities.
It's fascinating. Even with the U.S. out, the remaining member countries did manage to adopt a new pandemic agreement in May 2025, supposedly to improve future responses.
They did.
But how effective can that really be? If the U.S. isn't part of it and there are no real teeth, no penalties for countries that just ignore the agreement when the next crisis hits? Is it just paper?
Yeah, that's the million-dollar question, isn't it? There's a lot of skepticism. The agreement relies almost entirely on voluntary compliance, on goodwill. In today's very fractured geopolitical world, expecting countries to consistently prioritize global cooperation over national interests, especially without any enforcement mechanism, well, it makes the real-world effectiveness seem pretty limited from the start.
Yeah.
Hashtag track outro.
So pulling this all together, what does this deep dive really tell us? It feels like the WHO is fighting on multiple fronts, doesn't it? On one hand, you have these immense slow-burn health crises, NCDs killing tens of millions, the staggering mental health burden, loneliness, plus ongoing infectious threats like Mpox. And on the other hand, it's this constant battle for its own survival almost. fighting for financial integrity against the rise of anonymous funding and struggling to maintain political stability and relevance now that a major player like the U.S. has walked away.
That really captures the core tension, I think. The WHO is still doing absolutely essential work. For instance, they just adopted new guidelines to tackle the shocking disparity in pain relief, where over 80% of the world's morphine goes to rich countries, leaving millions in agony in poorer nations. That kind of structural work is vital.
Yeah.
But its fundamental ability to achieve health equity, to be that impartial global standard setter, it really hinges on transparency, especially around money, and maintaining neutrality in the face of these huge geopolitical shifts and industry pressures.
Which brings us to our final thought for you, the listener, to mull over. It really comes down to one word: control. When you look at those NCD statistics driven so heavily by commercial products, tobacco, fossil fuels, ultra-processed foods, and then you see the WHO increasingly reliant on large, often anonymous donations from private sources, you have to ask, who is really setting the global health agenda today? Is it the member states, the nations of the world, operating through these crucial multilateral bodies that are often starved for predictable funding? Or is it increasingly the industries and the powerful private interests who, let's face it, profit from the very sicknesses the WHO is trying to combat and who are now providing more and more of the funding? It's a tough question. What does that power dynamic mean for the future? For any real hope of achieving health equity for everyone, everywhere. Something to think about. That's it for this deep dive. We'll talk to you next time.